Welcome everybody. We are at 4 o'clock, so I suggest we make a start. Big welcome to everybody. My name's Mike Bell. I'm the co-chair of the Integrated Care Partnership here at South West London. I'd like to welcome Councillor Andreas Kirsch, the leader of Kingston Council. This is his first meeting as co-chair of the Integrated Care Partnership, so please join me in welcoming Andreas. We've also got quite a few new members of the Integrated Care Partnership, as it has been quite a gap since our last meeting, which was due to a series of elections that happened earlier this year, which now feel like an awfully long time ago, and we're sort of back into business as usual, but there has been a pause. So I am going to ask our colleagues to introduce themselves. So I've introduced Andreas. Sarah.
I'm Sarah Blow, Chief Executive of South West London ICS.
Imran Chowdhury, Director of Public Health at London Borough of Sutton.
John Byrne, Chief Medical Officer for the ICB.
Helen Jameson, Chief Finance Officer for the ICB.
Hi, I'm Melissa Chase-Filters, and I represent the Health Watch organisations in South West London.
Good evening, everyone. My name is Sarah, and I'm the Director of the South West London VCSE, Voluntary Community and Social Enterprise Sector Alliance.
Hi, my name is Charlotte Gorn. I'm the Executive Director of Partnerships, Communications and Engagement for NHS South West London.
Hello, I'm Elaine Clancy. I'm the Chief Nursing Officer for South West London.
Hello, I'm Piers. I'm the Health and Wellbeing Board Chair in Richmond, also Place Convener for Richmond.
Hello, I'm Anne Price, Governance Officer.
Ben Luscombe, Director of Corporate Affairs for the ICB.
I'm Brenda Scanlon. I'm the Place Rep from Croydon Place Board, and I'm the Chair of Age UK in Croydon.
Afternoon all, the MC Gibbons, Chair of Croydon Health Services.
Hello, I'm Peter McCabe. I'm the Cabinet Member for Health and Adult Social Care for Merton, and I'm the Chair of the Health and Wellbeing Board.
I'm Nick Merrifield. I'm the Place Representative on the ICP for Kingston. I'm a Kingston GP and the Deputy Clinical Director for Kingston.
Afternoon, I'm a Network Partner Corporate Director for Adult Social Care and Health in Croydon. I'm the Local Authority and Member for Social Care.
Evening, I'm Joe Farrer. I'm the Place Representative for Richmond, and I'm the Chief Executive of Kingston Richmond NHS Foundation Trust.
Hi there, I'm Matthew Hamilton. I'm the Director of the South London Partnership and the Local Authority Representative for Growth on this board.
Hello, I'm Karen Broughton. I'm Deputy Chief Executive of NHS South West London.
Excellent, thank you. Gillian. Big welcome to all of you. Just to let you know, one other key change is that we have a new representative on the Integrated Care Board from local authorities, and that's Hannah Doody from Merton Council. I was looking at you, Peter, thinking, it's Peter's council, which one is Merton? Just a reminder to everybody, this meeting is being broadcast online and recorded. The recording will be uploaded onto the ICP website after the meeting, and a version with British Sign Language will also be produced and uploaded. As this meeting is being recorded, when any of the members of the Partnership Board speak, if you could remember to use your microphone, that's the only way it will be picked up. A point of all, so can members, I've just said that one. Hearing loop is also available. A hearing loop is also available should anyone want to access it. And just a point of order, this is a meeting held in public, not a public meeting. So we will take questions at the end, should there be any from members of the public. We have received apologies from a number of people, so 3 of our trust chairs are unable to attend today. That's Anne Beasley, Sir Douglas Flint and Philip Hall. We've had apologies from Ian Dodds, who is the Director of Children's Services for Kingston and Richmond, from Yvette Hopley, the Chair of Croydon Health and Wellbeing Board, from Masad Mushtek, the Finance Director representative, Nicola Jones, the primary care representative, Hannah Doody, who I mentioned earlier, and also Councillor Graham Henderson, the Chair of Wandsworth Health and Wellbeing Board. But I can confirm this meeting is quorate and therefore plan to proceed. Please note that we've included a declaration of interests in the pack. Can I just check that there are no additional declarations of interest colleagues need to raise in advance of the meeting? Thank you. So if we could move on to the minutes of our last meeting, which remarkably was way back in January, January the 24th. I'm sure, like me, that meeting is fresh in your minds, and you're happy to confirm that this is a true and accurate record of that meeting. Fantastic, thank you. We approve the minutes. We just ought to note that it was co-chaired by myself and Ruth Dombey in the minutes. We're going to move on to a core issue for us. It's one of the areas of priority that the Integrated Care Partnership has identified, and that's mental health and well-being. So we're going to get an update on the strategic priorities. Can I ask Amy Scammell and Neil to join us? If you could introduce yourselves, Amy and Neil, that would be really helpful.
Of course, thanks. So my name is Amy Scammell, for those of you I don't know, and for streaming. I'm the Chief Strategy Officer at South West London St George's Mental Health Trust.
Hi everyone, I'm Neil Balmer, I'm Programme Lead for South London Listens.
So we've got a short presentation. I'm going to try and multitask. I'm going to try and click, read, and change the slides with the microphone. So let me know how I get on. Thanks so much for inviting us to speak with you today and for the focus item. I guess we really wanted to think with you around how we can work in partnership to deliver the South West London mental health strategy and also improve mental health outcomes and mental wellbeing across our system area. We've put a presentation into your packs. We'll click through, but we're not intending to work through every single slide, and we'll probably take 5 to 10 minutes to talk and then be really grateful for some open discussive space. So the presentation in the pack gives you some context for our work, and we'll just move things forward. So you'll see towards the end of the presentation, I think the last slide, there's some questions for consideration, and it's those it would be great to hold in our minds. Many people will know we have a South West London mental health strategy that was approved by the ICP board back in May 2023. The strategy has 6 aims, which you can see on the slide. It was developed collaboratively through quite significant data analysis and work through the Partnership Delivery Group for Mental Health in South West London, but also through contributions from over 1,000 people across our 6 boroughs. Our aims, I think you probably recognise and know well by this point, but really there's a focus on prevention, focus on equity for access, experience and outcomes. There's a focus on support specifically for children and young people, knowing that we can make the greatest input earlier in our life course. A focus on mental health workforce and what that might mean, how that might mean to change, and a focus on how we link up physical, mental health and social care together. A driving principle for us is involvement and co-production, so that runs throughout our strategy. There's a lot of work and it's quite complex, so we've organised it into 4 themes. So when you look at the document yourself, you'll see those 4 themes that are up on the slide now. We are in this 2nd year of delivery, so we've had about 9 months for delivery of our 1st year, and then we're now in the 2nd year. And what's really nice, I think, is that the strategy contributes to the 4 key purposes of an ICS, and hopefully we've been able to show some of the work that we're moving forward and how that contributes there. What's been really great is at the point that we're able to sort of publish and develop our strategy, we're also able to tie that to the wider ICP strategy and include in the wider ICP strategy a key focus area around positive mental wellbeing. And I'd really like to thank Councillor Allen and Anne Beasley for sponsoring that work stream and progressing that with us. We've got a number of areas in that positive mental wellbeing priority in the ICP strategy. They're all reflected in the mental health strategy. And what we've done for the ICP positive mental wellbeing focus area is really tried to think about where we can best work in partnership to get the biggest sort of impact and value. So through the ICP work, we're focused on healthy environments, knowing that those have a real impact on how we feel, how well we feel. Mental health literacy and reducing stigma, children, young people, and then also complex needs, recognising that we all need to work in partnership to support people with complex health and social care requirements. There's a great deal of work to do, and we've tried to capture on this slide, I guess, how we categorise the work. Some of it's very technical, and we would describe that as enabling work that we expect statutory organisations to do. Some of that is about pathway transformation and making improvements to clinical services and other service offers. And some of that is really around community engagement and activation, which is one of the things we want to talk through today. It's been really, really important for us to value partners in this space. And I think we do that in two ways. The first way is that we want to make an ongoing strategic commitment to valuing our voluntary and community sector workforce and to value those services appropriately and to pull our services into the delivery of the strategy. There's lots of ways that we need to do that, and some of the key issues that we need to resolve is sort of strategic and collective voice and sustainability of funding models. That's absolutely critical. I know Sarah will say more maybe later if she would like to. But the second area I'd like to hand over to Neil to talk about is really around community activation, and Neil's going to talk a little bit about South London Listens as a potential model.
Thank you very much, Amy, and very nice to meet you all. So, as I said, I'm Programme Lead for South London Listens. Now, South London Listens is a programme that's been working across South London, a partnership programme with the NHS, local authorities, and our community organisations that's testing out a model of how you use the power of community organising, working communities, to tackle systemic barriers to health and well-being. Now, and in fact, I should say there's many around this room who've been involved and engaged and supported that, and first to say thank you to all those. But what I want to do is get a bit of a context to how it came about and the sort of model, and then talk a bit about some of our priorities as we're developing them. So it started as an urgent response as a programme, as many of you may be aware, when the COVID pandemic hit. The three mental health trusts in South London came together and realised that actually the impacts of mental health were going to be huge and that something had to happen. But they also realised a couple of important points. And it's important making these points around an ICP group, where actually the first point being that they couldn't do it alone. They couldn't tackle the challenge of mental health alone as mental health trusts, but also as the NHS or as local authorities in the area. It had to be a partnership, and that the community had to be at the heart of that partnership. And more importantly, that community organising had to be at the heart of that work. So what developed from that was the idea of working with strategic partners, Citizens UK, and their network of communities they work in, to actually listen to communities, to understand priorities, to use a model of kind of really delving into organisations, to train leaders to understand and listen to the challenges, to find out what the priorities should be for tackling those. And I think thinking sometimes outside of the box of where perhaps the NHS and some local authorities may have been thinking in some areas. And so what emerged was initially listening to 6,000 people when the pandemic hit, and now, as you'll see from the slide, over 10,000 people we've listened to over 4 years now. And we've used this approach to identify priorities. So there are 5 priorities with South London Listens. Some you might expect from the pandemic: mental health and social isolation, children, young people's mental health. But some actually that came through were the wider socioeconomic challenges like housing, like work and wages, that really came from our communities where there need to be solutions. But it wasn't just about identifying solutions, about identifying challenges. It was about co-developing solutions. And so through community organising, we've been able to take kind of issues and start to build solutions with our partners and with communities, and bring NHS local authority leaders in the same room as communities to start sort of understanding And then the important part of that has been the accountability model. So bringing it initially on Zoom, but bringing everyone together once you've done this listening to say, these are the things we've worked on, can we commit to working together, and can we sort of share that? And we've done now over the 4 years, we had initially from Zoom, but that built over a number of years. And last year in Wandsworth, we came together with NHS local authority leaders to commit to a range of pledges and priorities. The first thing, actually, before I go to those, it's the next slide, there is a report, and so for those online, there are lots of them over there. This is our impact report for the first 2 years of the programme, and it sets out the plan of action that we worked through at this meeting last November. So the next slide looks at our priorities. I won't go through these in detail, but I suppose this just sets out the kind of core, the way this work is built, and we've developed it with our leaders. And you'll see a real breadth of areas and projects, from working with the ICBs to look at actually how becoming living wage systems, and how working with our communities and with Living Wage Foundation we can support the development of that work, to working on programs like safe surgeries, about working with migrant refugees and GP surgeries and improving access to huge systemic barriers to those groups. And then actually housing, which came through, and there was a big commitment made to bring NHS and local authority leaders together to look at the intersection of the health impacts and how partners could work together. And we have a big meeting tomorrow taking place with representatives across our 12 boroughs of South London, NHS and local authority, to look at what some solutions of that could be. So that's another priority. And then, and so a range of kind of pledges. The last thing on the slide I want to talk through, so those are some of the key themes, is our Be Well programme, because that's a piece of work that really underpins a lot of the sort of work we're doing with our programme. And that's where it's almost the engine of South London Listens. It's working in community organisations to kind of continue the work we're doing, to build capacity and work with partners to effectively help them take action on health and wellbeing and mental health. And so providing training and support, mentoring, continuing this listening approach to understand what the barriers are, and building links. Because ultimately, in a nutshell, the work we're trying to do is to tackle those big barriers, build trust, build relationships, and this work can kind of bring those together. I hope that gives an overview of the work we're doing. And that's a feedback slide.
Thank you very much. So we've asked you to reflect on 3 questions, which are in the final slide, which would be really helpful, I think, for us moving this work forward. Thank you.
Amy, Neil, thank you very, very much. And I know some of you attended some of those South London Listens meetings, and the energy, the engagement for both our community organisations, but also from members of the public, was really, really amazing. I think this is one of the most at-scale engagement programmes in the country, so it's a really, really impressive piece of work. And Neil, you're right to flag up tomorrow's meeting, which I shall be at, looking at housing with our colleagues from local authorities and third sector organisations to develop a really strong strategy. And there are some amazing examples in other parts of the country where systems have moved forward in terms of making sure that there are arrangements for staff, but also arrangements critically for particularly members of the public in affordable and social housing. So exciting time. We also have a new government which has prioritised house building, and again, I think we'll be looking at how we can use those levers. Gillian, you put your hand up. I did indeed. I don't miss a thing.
Thank you. I found the paperwork really interesting and your presentation, and I knew of the work, of course. But I wondered if you could demonstrate impact. I'm always interested, you know, we all know there's really good work, but if we only ever focus on the inputs, then I don't think we're clear enough about the impact of all that effort, and therefore whether it's most effectively directed. Sorry, Mike, I don't know whether to look at you or look at the, so I'm looking at you both. Anyway, that's my question. Thank you.
You want to start?
I will, yeah, absolutely start. And so, hopefully, the impact report we have there gives a sort of that you can take a copy of. Starts to show, I suppose, with any prevention programme, our initial impacts are the kind of outputs that we can show. And so, with things like living wage, we can show the number of people that have had wage uplifts because of some of the work we've been doing with working with mental health trusts to get them help them become living wage accredited. So we can show those initial areas. We can show in the mental health interventions in our community, we can show the numbers of people who have received training that's helped them feel more comfortable with how they can work with their communities. So there's initial impact that we've been developing across the range of our projects. What we're also trying to do is build a broader theory of change in actually looking at some of the deeper things we're trying to work at. So we work with the Centre for Society and Mental Health to develop an initial evaluation framework that we're trying to look at how do we start to sort of test some of those issues around trust, reputation, how do we start to test that this model is helping communities feel like they can engage and they can develop. That will be a longer term piece. So I think for the immediate impact, we have initial projects that can show the sort of traditional evaluation pieces, but then I think there's a broader, longer term thing we might try and develop.
I suppose I'm interested in the longer term, because if I was being challenging, I would say I think a lot of us are determined to do the living wage anyway. I'm sure that all helped, so I don't want to in any way to suggest it was unhelpful, but I think that latter point you made is where we really need to focus our efforts, don't we? Yeah. But thank you very much.
Thank you. So I've got a number of people with their hands up. I've had Zara, Andreas, John and Brenda so far. So we'll go in that order. Zara.
Thank you. The Alliance had mental health as one of their priorities, and so we've been quite lucky to be able to work closely with Emmy's team. And I think when it comes to the voluntary sector, the impact of our collaboration, if you want, can be seen in the initiatives we started and are growing, if you want. So the work we're doing with the VCC participation into the Mental Health Providers Collaborative, which is quite unique, if you want. It's the only providers collaborative where we are invited as equal partner to, think about how we can contribute from the start. And also, we've got representatives sitting on the mental health partnership groups. We're initiating some communications and discussions and conversations, if you want, that sometimes are difficult around commissioning and funding the voluntary sector around mental health, because in South West London we do have quite a few mental health charities commissioned directly by the South West London ICP. So there is a lot of work, And for us, I think, looking at the commitments that Amy had on the slides, it's really important to see commitments like longer-term funding models, for example, for the sector, because they kind of give us reassurance that this will allow the sector to kind of move away from piecemeal funding and, pilot projects, and maybe, particularly within the preventative area, start, collaborating on longer-term pieces of work. And I think we're seeing the changes. I've been to the Croydon Mental Health Alliance the other day, Brenda, and I was hearing about a 10-year, piece of work that is being planned. So I think changes are starting to take place, and it's all about continue to collaborate, to converse, and to find a way we can work together for more sustainability, I think.
Did you want to comment on that, or shall we take some comments at the end? Yeah, let's take a few at the end, a few more, and we'll take them at the end. Andrea.
Thank you. Thanks for the presentation, and it's really interesting strategy and a lot of great work there and good points. I really welcome the workshop, or the event tomorrow on housing, and I think it's really, really much needed, and on a general level. And I'm glad that it's happening. But I was wondering, in as far that we are at the moment, if you should also have a potentially greater focus on the actual crisis we are at the moment. We're not just, across our partnership, our 6 powers, but across the whole of London and other areas in the country. It's not just a housing crisis we have at the moment. It's really a human crisis, because you have so many, amongst all the boroughs, so many people in temporary accommodation, which, by definition is temporary, but it's not that temporary. It's now for months, sometimes years, and it's got in the last 2 years even worse. Every borough has a lot of families on nightly paid accommodation, on temporary. So for weeks or months, people live just in a hotel room or in a bed and breakfast with all the problems. They can't cook themselves, so it's not healthy food. There's not enough room for the kids and the parents to live together, do homework, have their own room space. It's a predicament for disaster on physical and mental well-being. I was just wondering and would like to make that the pledge that you also really look at what we together as partners could do for that imminent crisis we are living at the moment, to helping these families, prioritizing them. I know overall in housing there's a lot of work we need to do, but at the moment we really have an immense problem, which I think to address that is really important.
So, I mean, that's really helpful, and I think that's all information we should feed into tomorrow's meeting, that absolute sort of priority. If I could go to John next.
Thank you, Chair. So, thank you for this. I know there's been capacity issues which creates boundaries about how much you can do. So I've one question. Has there been any feedback in the listening exercises about drug and alcohol services in South West London? Because I don't think we can talk about prevention unless we understand how good, bad or indifferent our substance abuse services are, whether it's alcohol or drugs, and addictions, whether it's gambling or stuff like that. Now, I know that's commissioned separately under that local government arena, but I think we just need to understand, do what we have in South West London any good or not? And the reason I say that, look, I come from a family of alcoholics and gamblers, some of them who are unfortunately dead through premature addiction. So I'm asking that on behalf of people who haven't been as lucky as me, but undoubtedly this will be having significant impact on families right across South West London, and are sure we've got those basic services right, which is not quite mental health, but it absolutely feeds into mental health demand.
Thanks, John. Helpful questions, and it'd be useful to hear what feedback. And it may be that a bit of that will lead into our answer to question 2 in terms of some of the areas that we could strengthen moving forward. So I've got Brenda, Charlotte, Karen and Annette in that order. So Brenda.
Well, I'm sure I shouldn't be leading the pack on this one. But anyway, thanks, Mike. I guess for me, I think the information, the presentation you've done is really useful. But as colleagues have said, we're living in very constrained times for all sorts of reasons. I guess having read and thought about some of the other priorities that the ICP were taking forward in the strategy, there's a real issue that has been raised by many colleagues about where and how well did we prioritise the things we need to do. So I suppose for me, I'm saying, what are you actually going to do by way of the things that need to happen, and what is going to be dropped? Because actually in life we can't do everything. And I think that thinking about the issues around long-term sustainability in particular, there are going to have to be some choices made, otherwise we'll just have a general disappointment, if I can say. So that's not a criticism at all. How do we think about what are the must-dos in a time of huge, not just financial, but sort of societal constraint at the moment? So that's really my question.
Great question, Brenda, thank you. Charlotte.
So I was going to have a go at answering question 3 for you, which was how do we strengthen our partnership with the VCSE organisations to deliver improvements? So I think one of the ways we can really do this is continue to support our South West London VCSE Alliance. So Sarah is too modest to talk about her own contribution, but Sarah, you and the Alliance leaders have galvanised, our community groups across 6 places to kind of really bring together a real focus on mental health, which, and it plays to what you're saying, Brenda, you decided that should be the focus for the year, that mental health was a priority. And I think this programme shows that is a piece of best practice when we do kind of come together and focus. But I think the Alliance still has a lot of potential. We're still in the infancy, really, aren't we? The early days. And I think around elevating the voice of communities and learning from best practice, but also getting the voluntary sector in really, really early. I think, it's so important, because the voluntary sector has so many ideas and is probably so much more innovative, I think, than the statutory organisations. So I think a real example of best practice and what we can do when we come together across our 6 places and have a focus.
Thank you. Karen.
Thank you. When we came together in January, I was just reminding myself of the minutes, we talked about how the work that we're all doing creates an anti-racism framework and an anti-racist approach across health and social care. So I was really interested in understanding a little bit more about the work on race and migrations, if there's some specific things you could just bring out for us that would give us an idea of the kind of activities you're going to be doing in that area.
Thanks for that, Karen. And we probably ought to, at this point, feed in Councillor Graham Henderson's question on this particular item, which was mental health outcomes for ethnic minorities tend to be much poorer than other members of society. How does this strategy plan to address that? So if we can make sure that we're capturing that area. If I could go to Annette.
Right, I had a few questions, but I'm just going to, it's good, thank you very much for the presentation. We've had a new government, new King's Speech, and we've got the reforms in mental health that's coming through the system. How will this strategy, because we start something and then something else comes into the forefront and we will change direction. So it's to be mindful of what's been said in that King's Speech and what will be coming forward and very much on prevention, and it brings in inequality and it brings in detention, autism, learning disability. It's quite a wide bill, and I think if we don't think about this now, we will crack on with doing all of these fine things, but then we will be distracted. So just to be mindful of that.
It might also be worth, Neil, if you talk about the plan to re-engage with the public, because they do plan to hold us to account for delivery, don't they? So if you could mention a little bit about that, that would be really helpful. Imran.
Thank you, Chair. So first of all, I'd just like to say I love Citizens UK. I mean, just amazing some of the engagement and community activation I've seen. Both at South West London, but also in my own patch in Sutton, and been really impressed with the way you've trained up some of the community organisations. I think that's adding immense value, and something we as a South West London system should be really, really proud of, because I think actually it's a really good example of how we can work really well between levels, because often South West London level and place and neighbourhoods get in the way of each other. But actually this additional offer of support to neighbourhoods in terms of developing local organisations, but coming from South West London, works really, really well. So I think that's something that we should just recognise. I think Charlotte made a really interesting point about, what's the future look like? I think while there's been some really exciting community activation, engagement and activation, I just wonder, is the next step to think about and just challenge all of us as a system, so it's not just a question to yourselves, how do we integrate that offer at a community, at a neighbourhood level? So whether we're talking about, we're often quite kind of precious about our resources, aren't we? Whether it's a social prescriber, whether it's a mental health practitioner in a primary care network, whether it may be the Community Mental Health Trust, whether it's good thinking resource, which local authorities buy into, or Thrive, which the ICS buy into. We need to have those conversations where we join up this resource together. And so I think that's a reflection for me, for the board, but it's a challenge to see how we can actually accelerate that kind of thinking within places and neighbourhoods.
I'm going to go now, because we're going to need to move on, but I want to go back and give final words and any conclusions, any sort of responses to those comments to Amy and Neil.
I'm not confident I can answer all of those questions, but I'm going to try. I guess maybe I'll start off and I might hand to Neil for some of the tricky bits. Gillian and Brenda, you both asked around sort of outcomes and prioritisation. They're hugely important. In the South West London Mental Health Strategy, we have set clear, measurable outcomes that we expect to achieve, that we're ambitious for at 5 years and 10 years. They are stretching, and actually since the strategy was written, some of the performance that you might see against some of those metrics has actually deteriorated. So there is real stretch and challenge there, but they exist and they are measurable, so we should hold ourselves to those. I think it's really important when we think about prioritisation to think about what we can do in the short term, what we can do in the medium term, what we need to plan for the longer term. And that helps us maybe think about tracks of work that can move at different paces. I think we need to understand much better where investment is best directed. I think that's an improvement area for us, maybe as a partnership. You know, if we invest £100,000 here, what do we get, and what does that mean if we versus in another area? So I think the mental health strategy aims to do some of that technical enabling work to give us some confidence. And I think probably the majority of parties are agreed that investing in children and young people is really, really critical, because actually we know that serious mental illness appears effectively in most people by age 14 and then by age 25. So actually we really do need to invest earlier in our life course. So in terms of outcomes and priorities, there's some thoughts there. I guess in terms of some of the changes, Annette, you asked around sort of how do we make sure that we keep this live and real based on the changes that are coming. We've already seen some good work, I think, through the NHS, focusing on some core areas. So for people who have learning disability or autism and thinking about their needs. So a lot of the work that particularly mental health trusts are already doing is already aligned. And we hope our strategy and our work is agile enough to adapt. We hope that we haven't started any work that we would have to contradict or curtail, but we will have to weave in different elements as they come through. We have, as have other partners, I'm sure most people around the table, we've contributed to the feedback for the 10-year health plan, and we're having conversations through those working groups as they're set up, so I feel quite confident that we will be aligned. And I guess finally, maybe picking up anti-racism. I think there's some fantastic work that's already going on in South West London. We have the Ethnicity and Mental Health Improvement Project. We have some work in health inequalities across our partnership to really try and understand community needs and areas where we can make improvements. And then within mental health trusts ourselves, we have big programs of work on cultural competency or understanding how we reduce restrictive practice, which is disproportionately experienced by certain groups. So I think there is work there that we can build on, but it's very much early stages, I guess I would say. Do you want to take, you take some questions.
Sure. Thanks, Amy. I suppose just to start straight away with Councillor Hirsch, the housing issue. I think that's spot on the question. It's really important. I think it's fair to say that housing has been a theme through all of our listening for the last 4 years, but I think there's been a sense of trying to understand how best do we as a partnership with NHS and local authority tackle the fundamentals of it. Often I think the NHS and local authorities can work in their own silos in that point, rightly because the challenge is so great. And actually I think what's really exciting about the meeting we have tomorrow, the Housing Coalition meeting, is that the themes we're looking at, there's sort of 3 key themes. The first is actually what can the NHS do to look at its own estates to actually support the development of affordable housing, to actually start to sort of look at how that can work and how can it work in partnership with local authorities. And we're having really great conversations with NHS and local authority leads across the 12 boroughs of South London on that, firstly, so tackling that. And then how do we bring housing advocacy into health services more broadly to actually start to sort of tackle those challenges? How do we support people where they need it? How do we use the sort of touch point of the NHS to really get help to people in that process? So really excited by what that could hopefully deliver. And hopefully we will have action plans in each of the places across all our boroughs to really sort of show tangible sort of impacts across those. And we look forward to working with you on that. Very briefly, to go on the drug and alcohol services is a really important point. It's fair to say, I suppose, our listening hasn't directly worked on drug and alcohol services. We haven't done so, but having said that, it's a theme we know comes up through our work across communities. And so in Merton, for example, when the libraries are working with, they run an amazing group called Tuned In, which is a music group where a lot of them have drug and alcohol problems, and that's sort of core area of it. So we know that within our communities, so there's always more we can do, and it's important to kind of to be flagging. And I guess maybe it's for us to try and work out where we're seeing that across our different communities, how we might bring that together is a really useful point. And feed that listening in through the engagement points we have to start sort of the impact on the services. And then I guess the final point you made, Michael, around what's our kind of future plan around accountability? And this is always the kind of point. As in some ways, you've seen in the list of the slide that there are a lot of priorities still. You know, we're over 40 pledges we've been working on, and we're keen to actually continue to show delivery across those priorities on big issues like housing. But as we do that, new areas emerge, and so the housing project, for example, will come up with a number of things that need delivery on, so I suppose we're ambitious about that. But we are also engaging with the NHS consultation to show how our model can support some of that, and I know, Mike, you're supporting some of that work. And then I suppose it's on Imran's point, and it's worth saying Imran's been amazing in Sutton with helping us bring the partnership of the local authority and NHS together to sort of drive some of that work. And actually we are keen to try and see what we can do to kind of bring, so that, because an important point with the VCSE Alliance as well is that really what we're trying to do with the programme of South London Listens is not be everything and try and do everything. It's actually to be something that can enable, that can accelerate other existing really good work in partnerships. And that really is a key point around how do we get the work we do in the governance and accelerating the kind of infrastructure and capacity of the work we do.
Fantastic, thank you. I mean, I think that through that discussion, hopefully you feel like we've addressed the questions that you posed. I do think perhaps, Sarah, you might want to think about how we might engage some of our drug and alcohol voluntary sector in this discussion going forward, alongside the fact that we've got that community engagement as well. Your plea in terms of longer term funding was heard, even if we didn't comment too much on it. And I think it's probably worth noting that within London, there is currently work looking at things like social impact bonds when we're looking at some of those longer term preventative measures. And clearly that work in London is something that we could take forward in both parts of South London. And it's certainly something that Sarah and myself from South West London are listening to and actively engaged in through the London leadership team. So thank you very, very much. We will move on to our next item, and so a big welcome to Angela and Samantha. Angela, this is your first Integrated Care Partnership meeting, although you took over from Rachel, who'd supported us quite some time ago now, but we've cancelled all of the meetings due to elections that you were due to be with us. So I'm really pleased to welcome you and Samantha, and it's over to you now.
Okay, thank you very much. So Angela and I are going to do a double act on this. I'm going to start off and then pass over to Angela to do the juicy bit on the findings and the recommendations. So obviously you've got the paper in your pack that gives the full detail of this item, but what we're doing is presenting an overview and some recommendations on steps to improve the delivery of the ICP strategy following a light touch review that we conducted at the beginning of the summer, really. And we did this review in the context of being almost a year into delivery of the strategy and needing to start to think about what's next, and particularly in the context of a refresh and new delivery plans for the period post-March 2025. It was also undertaken in the context of feedback from you all on perhaps the high level of ambition of deliverability of that was set out in those delivery plans. So what we did was we talked to all the SROs and the co-leads. We looked at all the highlight reports being produced, and from that it was very clear that there's a high level of commitment to working in partnership across all the work streams to deliver the priorities, and that there is a lot of good work going on, and you can see that again from the examples in the paper, but also the vast amount of progress that is reported through the highlight reports that you've always also got in your pack as well. I think it's also worth mentioning the ICP Priorities Fund projects, and they've made a significant contribution to delivery of the priorities as well. They've also drawn in a lot of project leadership and delivery resource as well. So with that, I think I'm going to pass over to Angela.
Thanks, Sam. So for those of you that don't know me, I'm Angela Flaherty. I'm the Director of Strategy Development for South West London ICS. And I joined the team on the ICP back in the summer. One of my first activities was starting to have some of the conversations with our strategic priority leads to find out how things were going. Whilst we get highlight reports and we get delivery plans, they can mask 1,000 things, can't they? So actually starting to have a conversation about how is this work progressing. So we spent some time together, quite a few around this table in fact, to just have a check-in of actually this is what you thought you were going to be able to achieve when you set out and you developed this ambitious plan back in January and you had it signed off. Actually, how's it going today? What's the reality like for delivery? They kind of fell into a couple of key themes. One around deliverability, and then the other really around ownership and engagement. So deliverability one I'll take first. So they are ambitious plans. I think there were some very good intentions at the beginning, quite detailed plans that would be able to cover off those full suite of activities between now and the end of March, or between January and the end of March 2025. I think it's been clear that those have needed to be reprofiled, and some of those work streams have done that work and actually have been able to deliver on them. So particularly we call out CYP, so Elaine and team did some significant work in reprofiling the deliverables within that document. So they have now delivered on those priorities. We know that there's been competing priorities whereby the kind of delivery plans weren't, I suppose, isolated sets of activities. They're also picked up in other plans, both within the NHS or in local government. We know as well there's been a lot of operational pressures, so particularly talking with some of my NHS colleagues that were sitting in more operational roles, and also local government colleagues in operational roles too. It hasn't really been the time for the discussion that they would like to have had. The second part really around where delivery happens. So through the conversations, particularly with place colleagues as well, a little bit around actually where should this work happen? Should this be happening in a system level group through discussion? Should we have really clear actions that need to be taken forward by place? Actually being a bit smarter and clearer about how that work occurs. And also making sure that we're not just adding up other bits of work that exist already, that it's a unique, discrete activity that would truly add value. Then the final set of challenges, which we've coined ownership and engagement. And this was a kind of conversation, and it wasn't, it didn't apply to every work stream at all, but for some of them, there was minimal engagement of delivery partners outside of that core group. So people didn't feel involved, so broader folk from across South West London didn't feel engaged in the work. And we need to think through how we get that right and how we don't overburden people with information, but also how we make people feel involved. We know through talking frequently with Sarah that it's been variable again in the clarity around the VCSE roles and the different strategic priorities. And some it's really clear and there's good opportunity for engagement and actually going beyond engagement and going into that full co-design piece. And in others, it's less clear yet. There's also a feeling around a lack of understanding, particularly came through place colleagues that were talking about when they talk about the ICP outside of their kind of subject areas. Actually, what's the role of the ICP? What is the ICP strategy and what's it trying to do? So there's some work we can do about some succinct, handy comms, not even really big ticket comms, but just handy handouts for those people to take back to their place committees so they can communicate it. And then finally, there were some comments regarding the governance of the work streams and that how sometimes they were too NHS or operationally focused. You might remember that when we designed the governance for the ICP strategy, we tried to build on existing forums so that we didn't repeat or duplicate anything that was in place. I think we need to just have a little bit of a look at that too. So there's a couple of key recommendations that come out the back of those findings. One is to look back at those delivery plans. They do run out of road at the end of March this year, so we do have a need to do that in advance of the 10-year plan, which we'll see towards the summertime. So it might be a case of looking at the next at least 6 months so we can make clear what we're going to focus on for the first sort of 2 quarters of 25-26. There's then something when we do that delivery plan as well, just being really clear appraisal about where the work happens, being really clear about the resources required to deliver it, and just also setting ourselves some really high level sort of outcome metrics around them. And if we can't get to the outcome, actually what's the output we want to put in there? How do we want to make sure that we've been successful in the work that we've done? And then thinking through as well, when we go down to place, just being clear about the actions for place leads, and actions for other people in other parts of the system too, just so that we're clear about where the accountability for delivery sits. And then thinking about the ownership and engagement challenges, again, when we reappraise the work that we want to do for 25-26, who should be involved in that conversation? And actually, that it's not about ratifying papers at a committee. There are different stages of that process. So an earlier conversation with certain stakeholders need to be considered. So it's really thinking through, we want to deliver those activities, how do we involve people on that journey? And then finally, just thinking through as well around and Charlotte and I will have more conversations on this one, but actually how do we get our story around the ICP out there and about what the ICP strategy is trying to deliver? And there'll be multiple ways to do that, but there's some simple things that we could do about making sure that we equip everyone that needs to go out and talk about the ICP with some basic information about what we're trying to achieve. And then one of the last things that we were thinking through as well, and this is really down to the sponsors for each of the different ICP strategic priorities, is for them to act as a critical friend for the workstream leads when we're reappraising the delivery plans, so that we can have that really honest and challenging conversation around whether or not we've got the right things that are going to deliver those strategic priorities in our plans for 25-26.
Sam and Angela, thank you very much. So we'll move on to sort of any comments, questions people have. I know Sarah would like to come in.
Yeah, so thank you very much. I think that actually your voiceover is kind of gives us a bit more meat on the bone of the recommendations, to be honest, because when I read the recommendations, I thought, where is the review of the ambition to make sure that we are focusing in the right way? We may not have a lot of additional resource to be able to do this. I think Gillian, when we first set these objectives, did warn us about being over-ambitious in what we were trying to do and therefore not delivering. And I think that, you know, possibly there might have been a little bit of that. So I think good warning there, Gillian, and I think probably we just need to review that. We aren't going to solve everything by kind of communications. We are going to have some sort of hard objectives agreed that we believe we can achieve. We haven't got a huge amount of resource as individual organisations, so we all have to buy into what it is that we're doing. I get that, but we also have something realistic that we can deliver while still being challenging. So I think when we look at the recommendations as a board, I would encourage us to listen to what you've said rather than at what's absolutely written down here, because I think there is a big piece of work to do on the actual objectives and whether or not we think we can achieve them, and reviewing them and reprofiling them, as you said. So I think if we just take that into consideration.
And certainly as we begin to think of the new plan moving forward, I think Gillian's caution from last year is one that we need to make sure that we are reflecting and making sure that our priorities are achievable, deliverable, and that we're being sufficiently ambitious but not overly ambitious. Gillian, I think you wanted to come in.
Well, I wanted to make the point that you and Sarah have made, really, Mike, that we need to be ambitious. There's no point in us not being. But it's linked to the point about operational pressure and the ability of people. It's not that I was going through it again, and the ideas are all the right ones. So that's not the issue. I think it's the operational pressure that people are under, the resource constraints that people are under, and therefore I think we probably do need to try and do less in order that we do more, if you know what I mean. And the other point I wanted to make is, I've forgotten what we're called, the challenge people, or the sponsors. I'm not sure whether we're sponsors, but Graham and I do the one about prevention. And the problem there, I think, is that I kind of get told that there's a meeting and can I be there? And the reality is, my diary doesn't work like that. I would rather have a session periodically, which is planned, with the leads and have a real proper conversation about it, not, can you come to a meeting next week? Because that just isn't the way my diary works. And that's no criticism of anybody at all. You know, guys are trying to get on and do the work, which is the important thing. But I've been very conscious. I don't feel I've delivered my bit of it, but I can't deliver it in that way. So it's just a suggestion as to how that might work. Others may have been able to engage differently, but my diary's just under a lot of stress and pressure. Thanks. Thank you, Mike.
Thanks, Gillian. Yes, please, Alisa.
Thanks very much for your presentation. Just a quick question, because I see that the work streams that have been evaluated, I think, align with the priorities in the strategic plan, the IC, Integrated Care Strategy. In terms of the cross-cutting themes, were progress against those evaluated? I know don't remember them quite well, but I know that one of them was co-production. In the green agenda, Sarah's reminding me.
So yes, we can come back on that one. So there's 3, green, elevating patient and carer voice, and, oh, I've forgotten, EDI as well. Yes. Quick blank there. So those 3 had some high-level priorities. We didn't have delivery plans for those because they were cross-cutting and going through it. And actually a number of the ones within the cross-cutting theme around EDI was also picked up within workforce, and in fact quite a large component was picked up in the health and equalities ICP strategic priority. When we had the conversations with the leads for those areas, in particular, they felt that for the EDI and green that they were picked up sufficiently elsewhere at the moment. It's a further conversation about green needed. Should we refresh our ICP strategy, given some more considered focus? But we haven't evaluated those in a particular way.
Thank you. Charlotte?
Yeah, I suppose really an offer of something that might help. So over the past year, we've been collecting lots of insights from lots of different communities with my colleagues' help here, and we've just sense-checking some of the themes with Health Watch. Mike, you're chairing a community leaders event in January to again sense-check what we've heard. So in terms of talking about prioritisation and focus, that piece of work might help around these are the things that matter most to our community. So if we were thinking about, prioritising, then that could really be helpful, thinking about what our communities would feel would be most impactful, or what the concerns and issues that they have. So I suppose an offer of support that in the early new year we'll have a nice report with, I promise, a single slide on these are the themes that our communities are concerned about.
Absolutely take you up on that, Charlotte. That'd be great, thank you.
And I think, when I come back, I'm going to go to Yemisi, but when I come back, I'll ask you to sort of conclude. It would be helpful if you could say a little bit about when we're going to see the draft priorities for the first two quarters of next year. So that will take us through until September. And any plans that you're currently thinking through in terms of how we respond to the 10-year plan when that's published towards the end of May. So if you could sort of think about the answers to that, but I'll go to Yemisi now.
Thanks, Chair. I just wanted to pick up, because I'm not sure I completely picked it up necessarily. Have we looked at triangulation between the different work streams? Because whilst I understand that strapped for resources, strapped for time, there is such an overlap with some of the priorities in each section that actually working together might actually allow us to achieve our more challenging aims. Has that been considered?
So yes, I can come back on that if that would be helpful. So when you start to get to delivery plan level, which you'll see kind of in the back of the document, they get slightly more discrete as the activities are described in there. But they're not quite discrete enough. I think as part of that refresh process, that needs to be sharper. So there were quite a few related to, I think there was in 3 different places around the London Living Wage. And then there was one around, there was another one as well, that's was the anti-racism framework, lived in workforce and lived in health and equality. So things were sitting in a couple of places. I think as those plans had developed, they had become more specific. The reassurance is that in the background, those people are all involved and connected, so they're not creating them separately. So that connection is happening, but actually we need to put it on one person's list, not on everyone's list.
And within that context, there may be some cross-referencing to some of the other work that's happening either within individual places or as a system. So if I look at prevention and look at sort of priorities around either obesity or around personalised self-care, I know John and team are doing quite a lot of work for that, which is being reported into the ICB, not the ICP. So there's something as we begin to evolve the system where we make sure that all of that those multiple learning points are picked up in moving forward. I'll take Imran as a final comment and then we will close this item. So Imran.
Thanks, Chair. Just to agree with some of the points about the need to refocus and reprioritise. I think just a suggestion, I think, as well as looking at the needs of the population and looking at that again, because there are so many, I think there's also something about hitting a sweet spot where we're working together on something that addresses population health needs, but also really importantly now, given where organisations are, certainly local authorities, we're also working together on something which we think will also help our financial bottom line. I think that's really, really important to really get buy-in from organisations going forward.
Fantastic, that's really helpful, Imran. So please thank Sam and Angela. And we look forward to seeing you in 2025 with an update on our new priorities. I'm now going to hand over to my co-chair, Andreas. Over to you, Andreas.
Thank you, Mike. So the next item we have on the agenda is Connect to Work, and Matthew will present the item. Matthew, please.
Thanks, Andreas. You always hope when you get appointed to a new partnership board that you can sort of ease yourself in slowly and not have to talk. And here I am leading on 2 items, in partnership Joe on 1, but I will try and not detain you too long on this. So I was at a conference of support employment providers this morning, and the Minister for Employment actually spoke at that and emphasised and underlined the importance of not just the white paper, Get Britain Working, but the element in it which is Connect to Work. And the emphasis that she was placing on that was the importance of working in partnership between local authorities, health and the voluntary sector in ensuring that Connect to Work is the success that they hope it to be. So you will have received correspondence already as the ICB about this programme and the importance of it. And what I'm doing today is just to give you a quick overview of how it's sort of going to be taken forward and where it all sits and what the focus is. So Connect to Work is a voluntary supported employment programme which will provide support for people who are economically inactive within priority groups, and that's specifically disabled people and people with health conditions that make it harder for them to secure employment but want to work. And it will also provide, and sometimes this gets lost, support to people to retain work who are at risk of losing employment, and if they lose their job they would be unlikely to move back into work without some sort of support. So the intention is for it to be a high quality personalised programme, and it's very much about putting the individual at the heart of decision making. That is a different approach from DWP, and already you can sense that just in the way that when we're asking them questions they're saying the response tends to be, well, that's for you to decide. That is not normal for DWP, I can assure you. It is normally every I is dotted and every T is crossed. We are not seeing that in that approach. So the more devolved approach is certainly in the early stages playing out in that. So the programme is seeking to support individuals who would not normally engage with job centres and employment brokerage services. So the traditional job employment approach is being negated, and it's also looking to support those with multiple and complex needs, but crucially who want to work. So clearly health care and VCSE providers are going to be absolutely key to the success of this programme, particularly in terms of referrals as primary referral partners. So in London, the programme is being devolved down at sub-regional level. So the SLP is the sub-region for this part of London, and Croydon Council will be the sort of accountable body. And we are in partnership developing a programme of support which will be delivered across the SLP boroughs over the next 5 years. So this is a long-term commitment in terms of funding. We're looking at about a £20 million programme. So we are already, despite the fact that the gun on the Get Britain Working white paper only got fired last week, we were given prior sight of some of the guidance, so we're able to start some of the initial conversations with key stakeholders to ensure that we can start to develop a delivery plan. Why is it important that we have those discussions? Well, A, as I've said, the referral pathways will be absolutely key to this. So it's really, really important that we can tap into what already works and what works well, but also that we take this forward in that spirit of partnership. And that's something that Joe and I will be talking about later in the anchor discussion. But this will be how that operates writ large. So really important opportunity. I think we've already held about 6 or 7 engagement exercises over during November, but keen to continue the conversation as we help shape the delivery plan that we're looking to get in place by the end of the year, start of next year, because we're looking to get this programme up and running by June as in terms of the go live date. So really what I'm looking for today is a couple of things really. Just reflections on how we can best integrate into existing networks and referral pathways, because clearly we want to work in partnership on this. Any reflections about, what will particularly work, and I suppose the extent to which this group would want to continue to be informed and provide a steer to this joint working and this joint programme going forward. I'll pause there.
Thank you, Matthew. So we've got a clear ask from Matthew what we are supposed to do now, and I have Saba first, please.
Can I just ask a very kind of technical question? It's just that this partnership is the 6 boroughs and South London partnership is the 5 boroughs.
Yeah.
Do we work separately with another partnership around Wandsworth, or how does this work, or are you working together with Wandsworth? Because obviously we would want to make sure this works for all 6 boroughs. I'm just wondering how that works for us.
That's a great question, and one that we've been teasing out. I think it's likely, at the moment we're just trying to tease out the detail. I think it's likely that there will be a slightly hybrid model in which Richmond and Wandsworth, who obviously operate in a sort of coterminous way as councils, will operate direct delivery. But you're absolutely right, Wandsworth will ultimately fall under the umbrella of the Centre London Forward sub-region. But I think the way that they're going to approach it is to have a similar model for Richmond and Wandsworth. In addition to that, there will be a sub-regional programme for the 4 other boroughs, but we were already talked with Richmond about the importance of being integrated in terms of that approach. So it isn't completely ideal, but unfortunately the sub-regional map and the ICS map don't neatly confirm. But what I would say is a lot of discussion has already gone about how we ensure that that works effectively.
Thank you. Next is John, please.
So, thank you. The question is related to eligibility, and bearing in mind we've just had the conversation based on what South London Listen says to us, and I've asked the question about drug and alcohol services. So, in terms of the people who are not eligible, are we confident and satisfied that services are actually robust and available for people with either drug and alcohol problems or mental health problems? As before we embark on a whole new sort of cohort of people to support them back into work, are we making sure the most vulnerable are already getting what they need? Because we don't want to replicate the mistakes if those services aren't quite as effective as they could be or should be.
Yeah, I couldn't agree more with that, and I think actually developing something where I think the focus is about where this programme is particularly suited. And where it isn't, and where other options should come into play. And I think that referral pathway is absolutely key to that. The emphasis on the programme is that it is very much about the individual. And so what should flow from that is that the individual gets support that really meets that individual's need. But that's easier said than done, isn't it? And I think key to the early part of this, so in terms of referrals, the sort of pattern is sort of slow in the first year and then ramp up. Part of that first year will be making sure and engaging with colleagues about are people getting the right support compared with the other opportunities that exist within the system.
Thank you. So given we have plenty of people who would like to ask questions on this, given that we are already running late on the agenda, could I ask everyone please to be concise with your question or comment, and Matthew also with your answer, so because I don't want to close it down. There's so much interest here. Oh, sorry. There's so much interest here, and I don't want to close it down. Just everybody, please, let's be as concise as possible so that everybody has a chance to ask their questions or give their comments. So next on my list is Mike.
So that, I mean, I think it's great news that DWP are really actually devolving power in this space, because it's often a rhetorical position, and hearing that it actually really is the case is really encouraging. It means we can tailor it appropriately to our community in this part of South London. A couple of questions. One is, I mean, clearly this is of quite a substantial scale in terms of you know, potentially 5,000 plus people going through it, 2,500 people at least expected to be employed. My key question is one about making sure that we are aligning this with our other programs, particularly Apprenticeship Levy and the new freedoms we have, particularly on the NHS side, to sponsor more widely than we previously could. So, you know, I'm hoping that by the end of next year, we're not sending any of our Apprenticeship Levy money back to Treasury.
Yeah, I think it won't work if we're not doing that. I couldn't agree more.
Thank you. And next is Nick, please.
Thanks, Matthew. Absolutely, I think this is a real gap between employability, health and care, and absolutely mental health is a really key one. In primary care, I would encourage the social prescribing sort of movement cohort set of staff to be important in this. But also people within local authorities and within acute trusts and other places where social prescribing is being done, even if it may be called something slightly different, but there's a very similar sort of role. So we're seeing an awful lot of people in primary care who've got employment challenges, employment needs, and whose health actually would be greatly enhanced by getting into work. We know it's generally almost always a good thing to be in work. Yeah, there's an awful lot of people who would fit into this category that we are seeing every day in primary care. Thanks.
Thanks, that's really helpful, Nick. Appreciate that.
Thank you. And next is Sarah, please.
Just a very quick comment when it comes to the voluntary sector. I know you've got a network of employment, you know, VCSE groups, but I was thinking you might also want to work with long-term conditions, VCSE groups, careers information centres, food banks as well, and faith groups might be, you know, a good point of contact. And volunteer centres, because the volunteer centres come across quite a few people with, you know, health issues who are on long-term unemployment but still want to contribute, and some of them are, you know, wanting to move on to paid employment. And sorry, just to say, obviously, I guess the best point of contact is the local CVS, and of course you can come from me as well to get those contact details.
Thanks, that's really helpful steers, and certainly ones that we'll take forward. I think the other thing I just want to stress is that this is a 5-year programme, so we don't need to race to get it right from day one, and part of this is the learning, and actually as we start to identify gaps in terms of referrals, etc., having those ongoing conversations and plugging ourselves elsewhere will be crucial to the success of this.
Thank you. Next is Karen.
So 3 things from my perspective. The first is, in order to make a very personalised offer work, we're going to have to train managers to make sure that they understand what that looks like and how they can support and help people into employment. So I'm interested in the kind of support and training. We've just introduced it in the NHS, a disability advice line across provider organisations in order to support managers and help people stay in employment. So I suppose that showed me the kind of the gap that was there. So interested in the training that's going to come forward. If I look at some of the things that I tried to do as a partnership before in terms of work placements, etc., we probably haven't achieved the levels that we wanted to achieve. So there's also something for me about the pathway of getting people into employment almost has to have protected posts. Otherwise, we will do lots of things, but we actually won't get them back into employment. And then the final thing for me is the capacity in organisations to make this happen. So how do we then make sure that people are adequately supported when they're in? And just finally, well, I said 3, there's 4. I think we just need to review the rest of the workforce elements to say, are we asking too much of organisations, and do we need to reprioritise then what we're trying to achieve?
Yeah, I think training that the DWP are looking at that in the round at a national level as well as individual level, but we'd certainly be looking at any gaps that emerge from that. I think the protective posts is a really important one. Obviously, it's a very person-centred approach, but at the same time, that's all very well said, but you need the roles for them to then to go into, and I think striking that balance will be absolutely crucial, and I think we'll be doing ourselves a disservice if we don't, if we utilise this programme but don't have those posts there for people to get into. And I think again, mapping where people are tending to focus and want to get into will be absolutely crucial to this. And I think, sorry, what's your
capacity of organisations to do it, particularly when we're asking also them to provide work experience placements, etc. So just how do we align all of those things?
Yeah, and I think key to that, an important part of that will be ensuring that the commission service, the provider, actually has some of that ability to and a track record in engaging with other organisations to build on that, because they're going to have to do some of the heavy lifting as well. And actually, by working collaboratively and knowing what works will be crucial to that, because, as you say, there is a capacity gap.
Thank you. Peter's next. Yeah, so Graham was, Councillor Henderson was asking, to what extent will this important programme build on Dame Carol Black's review of the health and working age population that was published in the late 2000s and run until the early 2010s?
So I was actually in the Department of Health when that was being written. Isn't that helpful? So, so I'm aware of some of the emerging messages, and hey, as my first job was actually writing the NHS Plan 2000, being one of the authors of that, and we're still saying some of the stuff now in 2024. So what I would say is there was an intensive 2-year review led by the Supported Employment Alliance about this, that actually drew on some of the lessons that have been learnt through reports over an extensive period. And that review has led to this approach, which is a different approach, and also engaged a lot with health and care stakeholders. So that was a 2-year review. That is the product of that, but I do know it drew on some of potentially some of the much repeated lessons from previous reviews.
Thank you. Next is Julian.
Question, it's just a comment, and you may well know of Project Search, but it's an organisation that does a lot of work with both my hospitals, people with learning difficulties, really successful, so worth you making contacts there.
Noted, and contact will be made.
Thank you. And Imran, please.
Thank you, Chair. Just a quick comment from me, really. I think it would be really helpful for the board to kind of get a baseline of where we are now. So I was just thinking about things like metrics around, referrals and kind of apprenticeships offered, for example, between organisations and maybe places. Everyone loves the league table, don't they? That would be really helpful, maybe, next time you come back.
Yeah, I think that's a really important thing. I think when you commission services, sometimes data is the thing that you ask for halfway through the programme. And then the provider turns around and goes, well, we didn't know you wanted that. So actually, I think a key element of the commissioning will be ensuring that data runs through the heart of this, so that for once it's 5 years, for once we've got a bit of longer time, so let's learn the lessons that the data tells us. So we'll make sure that's a key part of that. I can't promise it for the next meeting, though.
And last but not least, Annette, please.
Yeah. I think this is a fantastic opportunity, and we've got to map it out because this could make a real difference. It'd be really interesting to have some lived experience who go through this, to have a story of a couple of people that actually have succeeded, or where they haven't, and why, what held them back. I think all of us around this table will contract, and we commission and procure a huge amount of contracts. And when we commission for these contracts, we should be looking at social value, and we should be looking at how could we support this through these providers creating roles for individuals to come back into work.
Thank you. And thanks everyone for the interest in the topic. So we had plenty of comments and questions, so it's really good.
Nice, easy introduction to my time on this.
So it's really, like Annette said, really, it sounds really progressive, and the person-centered approach, something new. So really looking forward to this. And a round of thanks for Matthew, please. Next on our agenda is the preparation and learning from adult social care quality commissioning assurance. So this is something, you know, after we used that in children's services, now for adult social care, it's coming as well. And a couple already had the engagement and the assurance to CQC already. I think Annette and John giving us a presentation, and then we delve into the topic.
Good evening, and thank you for inviting me here tonight. My name is John Morgan. I'm the Executive Director, Adult Social Care, Integrated Care and Public Health here in Merton. And I'm here, of course, with my colleague, friend and counterpart from Croydon, who will step in, I'm sure, to when it's needed. Now, you'll be glad to know I'm not taking you through the presentation. I'm conscious of the time. The slides and the executive summary are in the pack, so I'm going to give you a quick overview and then hopefully some questions. So, adult social care hasn't been formally inspected, hasn't been a regulated service since about 2009 or 10. But since then, that doesn't mean that we haven't had a process of external monitoring, challenge and improvement. In its place, when the CQC stopped, we had ADAS, the Association of Directors, and the CQC, who provided that challenge within the boroughs. And that's been going on for the last over a decade. That changed, of course, in April, when the law changed and we're a regulated body again. The initial intention was that it was local authorities and ICSs, but the ICS part of it is paused at the moment. Now, paused, I don't know if that means stopped, if that means paused, or if that means they're planning something else, but it is stopped. But that doesn't mean that ICSs and all of our partners aren't involved really fully in this, and I'll take you through that a little bit as I move on. So, changed in October, and since then, local authorities have been doing a huge amount of work in preparation. Firstly, from June the previous year, there were 5 pilot sites across England that the CQC were working on the model and how they would work with us. And we've been monitoring that and learning from that throughout, as individual boroughs, as South West London, but also with the LGA and ADAS supporting us with that as well. All of the South West London boroughs have again either had LGA or ADAS peer review, which have mirrored the process that the CQC would be doing to look at our preparedness and our readiness for the CQC coming. Huge amount of work, of course, with documents, forms, data, and all the rest. 2 boroughs have been contacted in South West London. One is Kingston, and they're expecting their inspection at the end of February. The other borough that's been contacted is my one, the London Borough of Merton. And I thought it might be useful just to take you through a little bit of the process, because it really will highlight how our partners are involved in this. So Merton were notified on the 11th of December. Within that, they told us that we will be coming to you within the next 5 to 6 months. That's April or May for Merton. But we had 3 weeks to supply them with a key set of data. The first 3 days, we had to supply them with over 200 names. And it was very prescribed. Names, details of your place board, all of your partnership meetings, all of your key people in health, social care across the council and the voluntary sector. Now, of course, we haven't just given the names without telling people we've done it. We've notified all of these people. We've let them know that their names were the ones that have been put forward. And what the CQC have told us is that those people might form part of the inspection itself and be invited to some of the key meetings over the 3 days that they're here. But they will be contacted, on top of that, they may be contacted any time from now till they come, that they will be contacted either in person, telephone, or by email for relevant information. Now, the CQC, most of the people here have been involved in these inspections for years, whether it's a regulated service. We've all been involved in them over the years. So again, I'm not going to take you through the methodology and things, it's all in the pack. other than to ask, is there anything that my colleague Annette would like to add to that?
Yes, thanks. So there's four themes that they'll assess us under: working with people, providing support, ensuring safety and leadership. That's high level. But we're all involved in multi-agency safeguarding, we're all involved in working with people at place, and it is around the integration and the good quality commissioning, what we're commissioning at place. But also, if we look at those themes and we match them to the strategy that we've got here at South West London, you can see the themes and the golden thread running through them. So it is important that as a system, South West London, that we've got a narrative, that we have got a narrative that we are all signed up to. And there's been a piece of work with Sam and the DASs and our place leads to look at the narrative and not deviating from what we've got at South West London, that we're all clear of the narrative and we share that across the piece. But it's really important that we want to do well, because it reflects on the South West London, but also on our places. So, you know, the DASs and learning from children's in Ofsted. So I think some of the work that we are doing, it's easy to think, oh, it's the local authority, it's over there. It really is not. This is a partnership effort, and it is really showing what we are doing well, but what we're not doing so well and where we can improve on. And each place will be different in different places. So the self-assessment that John has submitted is they're going to be looking at, do you know yourself? And if you know yourself, they will be looking at, well, what have you done? Where's the weaknesses? Where's the strengths? And that's got to be evidence-based in data and performance. And then they will be doing the checks with different people. So it will be the residents, the safeguarding board, the all different people. They will be checking that out. And then they will give us a score. So there will be, and it's one determination that we will be either excellent, good, requires improvement, or inadequate. So they're the four elements. Across London, so we are working across London, and there is a mixed bag of what's coming out in the inspections. So we have got places that have done well. There's been no outstanding at the moment, has there? No outstanding. There's been some
From
good.
the data so far, it's 15 local authorities have had their ratings, it's 10 have been good, and I think it's 4 or 5 have been requires improvement.
Improvements, yeah. So we are working together and we're learning together to do well here for South West London.
The only other thing I wanted to add, thank you Annette, was so the 3 weeks that were given, we had to give the names of the people, and then by the last day of the 3 weeks we had to supply all the information to show our evidence against the key lines of inquiry. Merton had to submit over 257 documents. Those weren't just Merton documents, those were partnership documents from place boards, from integration. So it really is, while it is adult social care, it is a quality assurance of place, each of our individual places. So again, to echo Annette's part, is a very partnership process that we are looking for. Okay. Any questions?
Thank you. I already have Sarah who would like to come in.
So mine is more of a commitment. So we absolutely, I think, from the NHS perspective, commit to the partnership within this. Historically, in South West London, we've done very well around. And if we look at some of our children's, I know our teams have leaned into the assessments, and definitely the teams will continue to do that around this adults' work. So absolute commitment from myself and my team that we will support and do whatever is required in order to show that we do have good partnerships in South West London, and actually they work really well. And we want the local authorities' assessments to be successful, because, as you say, that's a reflection on us as much as it is on you guys. It's about how we work together. So I think we do have a really good grounding in that, and I know the place leads are really committed. I know that Elaine has been committed on around the children's work and will continue to be on the safeguarding, I'm sure. So we will absolutely lean into this from our perspective.
Thank you.
Thank you very much. I've been involved in a couple of preparations and CQC assurance development, and I think the one thing that has come out strongly, so this is not to decry anything that's been said is for those places where the evidence on partnership has been very strong, there has been comment that that's excellent, but actually when you go and speak to service users or you speak to frontline staff, that's the core question is what are the outcomes for local people? So we can, I hope I don't sound like the spectre at the feast, I'm not trying to, but there is that stuff which of course great partnership fosters excellent frontline work, but there is something about at the end of the day, it's what are the outcomes for local people, which I know John is really clued up on. But I think it's that in mind. And I guess within adult social care in particular, because a lot of this is about what are the outcomes for individuals and people, rather than necessarily always about populations. There's a slight difference of emphasis there, which I think also is just something to bear in mind. So I hope that comment, it's meant to be a really positive one about what Annette and John have described, but I just think it's useful to reflect on that as well, if I may.
Thanks. Thank you, Brenda. Next is Imran, please.
Thank you, Chair. And I think just a quick reflection, really. So I think it's really helpful to think strategically around this board, you know, how the South West London system can contribute to some of this. And I think it's really important that we celebrate some of the amazing work which was in the ICB annual report around the Kingston proactive care model, for example. And that is a phenomenal work. And I really want to acknowledge that, actually, because actually taking a cohort of frail elderly people, I think over 2,000 or so if I recall, and reducing non-elective admissions by 50% is huge benefit for the healthcare system, but also for adult social care and local authorities. So we need to be shouting about stuff like that and thinking together how we roll stuff like that out, if possible, in the future.
Thank you.
You would like me to...
Yes, Sarah?
So I'll respond to that, and actually we've got somebody that delivers it over here, so probably wouldn't want to say, but I think we do want to roll out the best practice across South West London for things like the proactive care model. We want integrated neighbourhood teams to work in every borough in a way that makes sense. We want to work with all the partners to make sure that we have a model where you get a minimum standard in South West London, no matter where you live in South West London. So I think so I'm sure that Nick would be very pleased with that reference, but I do think it is how do we roll that out across everyone, because we do have differentials across South West London, we recognise that.
Thank you, Sarah. Is there anyone else on this? Seems not to be the case. So before we give a round of applause to John and Annette, I just wanted to say a thanks to Sarah as well and everyone else who gave the strong commitment, and we as a partnership, you know, want to take this forward, and as South West London have the certain standards. And I think what Brenda mentioned, you know, it's in the end also, obviously we get our local authorities, adult social care will be judged and looked at, but it works, like you mentioned, only in a partnership. We're all in that boat. It's not just the local authorities. And but it's also, like you said, Brenda, I know it's about outcomes for residents in the end. And from what Imran said, again, just highlighting that, celebrating success, you know, and having motivated staff who is happy, you know, about and proud about what they're doing and what the work they're achieving across all our partnerships, I think is really important, so that they can give the best outcomes to our residents and the people who actually need the care. So, round of applause for Annette and John, please. Okay, the next item is the South West London Anchor development, and we have Joe and Matthew who would like to take us through this item.
Okay, thank you, Chair. And we'll do a bit of a double act here, also mindful of the time and the fact that you have got the papers with you, so we might canter through this so we can then get to the discussion. But what we'd like to share with colleagues this evening is just a little bit of the work that's currently underway from our perspective under the banner of Anchor, but also a huge amount of work that's been going on with the South London Partnership from a civic collaborative perspective. We also want to share some insight that we've gleaned by our closer working over the past couple of months or so, and then propose a way forward. What I was going to start by doing is just sharing a little bit of what's going on within the NHS within South West London, and you may or may not be aware, but From an NHS perspective, we approach anchor work under 5 pillars around workforce, sustainability, procurement, civic partnerships and estates. And what you'll see within the pack here are examples of the activity that we're undertaking under each of those pillars, both across South West London, but also within each of our places. And I think you'll see there is a lot of activity going on, but it probably could be a little more coordinated. And also from my perspective, I think we have a lot to learn from our local authority colleagues, particularly given the work that they've been undertaking with the South London Partnership. And you're about to hear a little bit more about that. I think we've got a real opportunity not just to share best practice within the NHS across places at a South West London level, but we've also got a huge opportunity, I think, to learn from our local authority colleagues in the work they've been doing as part of the South London Partnership. We're going to hear from Matthew now, and then we'll hear a little bit more about what we're planning to do to take things forward. So, Matthew.
Thanks, Joe. And just to say, really welcome the opportunity to sort of discuss this in a collaborative partnership way, very much the spirit of what the item is intended to do. I think it's probably worth reflecting that we're not starting from scratch on this. And yes, there might be the concept of anchor that has got more kudos in recent years, but what essentially we're talking about is players within the system who have the sort of heft of influence to ensure important change in the ecosystem that we operate in. So for local authorities, through the South London Partnership, very much the 5 boroughs see a crucial role of the South London Partnership as actually bringing together those players in the system who operate on a geography that is wider than individual borough boundaries. And we've really tried to work to establish effective and productive relationships, not just with the NHS, which is an obvious one, but with HEIs. So we've set up a big programme called Business Innovation and Growth, where we try to position businesses in the area with universities and FE providers to get mutual benefit around knowledge exchange and research that has had real demonstrable benefits. We've also run a number of programs that engage with voluntary sector, with employers, with employment support providers, and they very much cross-reference. So a really good example is the careers hubs that we run, where we work collaboratively with over 100 schools across London. But again, it's talking to those schools in that sort of collaborative, wider way, not just having 100 conversations with 100 different schools. And I think what has come out from that is there's a nice sort of diagram in your papers about the sort of NHS Confederation sort of model when it comes to anchor institutions. And what we've tried to do in that slide is to sort of map out where our South London Partnership local authority engagement maps onto that sort of approach. And you'll see there's a lot of natural synergies. It wasn't a hard slide to write. Sometimes they are hard things to write. You're thinking, how do I squeeze that in? It wasn't the case for this one. And I think that conversation and that awareness of what already works led us to, Joe and I and others, to a discussion about, okay, we've got a really good base, but where do we now, can we now move to, given the importance and the influence of the NHS within the South West London system. It is, after all, the biggest employer within the SLP area. How can we build on what works well and now take it to the next level? So really, what we then start to think about is the sort of what next. So I don't know if you wanted to say.
Yeah, if I say a little bit more about that, I mean, it is clear that there is a lot of benefit in us working more closely together on this. And I think the timing is, the stars are beginning to line a bit. We know we've got the 10-year plan that is, in development as we speak. And we also know that the London Mayor's growth strategy is firming up. So all of these things absolutely sort of intersect around this civic activity and the anchor work that we could do. I think the conversations that we've been having over sort of the past couple of months or so are around, where is it that we can, as the NHS, play a more coordinated and supportive role to local authority colleagues, and where is it that the NHS could actually play a lead role in some of this activity? So I think we're very keen to sort of take those conversations forward. We've got a bit of proposal that Matthew will share with you shortly, but we think this is a huge opportunity for us collectively to come together, pool our resources and coordinate our efforts in a way that we've not done before.
Yeah, and the benefits of this was shown for those of you who attended. There was a Health Innovation Summit last week held in Croydon. We had over 250 representatives from the NHS, from business, from research, from universities, from FE, all coming together to learn about how we can use sort of digital inclusion and other things to benefit the health economy. And that was really great sessions, really working collaboratively together, and they're a great example of partnership in action. I think what we're proposing to get the views of the ICP on is that we hold a session in the new year that highlights, starts to map out and highlight some of the benefits of increased collaboration, and uses some of the sort of momentum behind things like growth that are coming out of government to explain how anchor systems play a role in that. It also opportunity to map what already is there, but where the NHS and others would want to play more of a role, or a leading role, or provide an extra shoulder to the wheel for existing activity, and then work with collaboratively in working group sessions with wider stakeholders to identify that. Also to determine the appetite for increased collaboration. My bet is that there will be appetite for some, but it's important to at least ask that question. And then I think have a clear endpoint, which is we go out of that with a clear map, having worked in partnership, about what are the sort of identified areas where closer partnership working collaboration would be of benefit, and what role does the NHS play in that? Because it won't always be the same for different activity, and it's important that we don't reinvent the wheel, but we utilise what works well, but also to spot any gaps where we can move things forward. So reflections on that would be very welcome.
Yeah. So I think that's kind of the end of our presentation bit. I think what we're keen to do is sort of understand whether there is support here for us to take forward the workshop that Matthew's outlined. We hope there is, because we'd like to bring the insight that we would glean from that back here to a future meeting. We obviously want you to note the sort of existing activity that is going on across South West London, across all partners and stakeholders, and if there's any sort of other immediate gaps in the areas that we are focusing on that you think there'd be merit in us picking up, it'd be really good to hear about those.
Thank you, thanks Joe, and thanks Matthew. I have a couple of people already. Yep, and first in line is Brenda, please. I think you put your hand up very early on.
Oh, no, I'm not going to comment on institutions yet, sorry. If I put my hand up, it was a mistake.
Sorry, that was me. I thought I saw you put your hands up and I told Andreas.
No worries. So that brings us to Mike next.
So sorry.
No worries.
So Joe knows I'm hugely supportive of this idea of moving forward. I just wanted to add one more thing to the item, and Joe, you won't be surprised at this following our conversation this morning, where life sciences is a major economic opportunity for us in South West London. We have a new university on our patch. City University is now has now merged with Southwest London, with St George's University. That provides a major opportunity, and of course we have one of the leading international cancer centres with Royal Marsden. All of that is an opportunity for us to move forward on. That may sound a bit NHS-y, but actually this is a critical issue in terms of economic development for our local authorities, and working with you around things like planning, in terms of things like lab facilities, etc., and looking at ways in which not only we could do the research, but we could actually attract some of the pharmaceutical businesses to locate within South West London is a really significant opportunity for high-skill, high-paid jobs to come into our community.
Can I just come back on that, because I completely agree. I've deliberately referenced the growth, links to growth, and one of the 4 pillars, I think, of the London Growth Plan will be life sciences. That's the clearly emerging. Councillor Kirsch would be having a word with me at the end if I was not highlighting that local authorities themselves see life sciences as a really vital cluster to our area, and for all the reasons that you've set out, so very much front and centre of our work at the moment, and very much so going forward.
Thank you. Next is Emily.
Yemisi.
Sorry.
It's okay, not to worry. I am really pleased that this anchor work has actually come to the ICP, because there's a natural synergy with a lot of the stuff that we've discussed today. We were talking, we had a presentation from the South London Speaks, and their second priority is work and wages, and also they've got the priority of supporting recruitment initiatives, which fits in with the anchor work. We listened to the presentation, Connect to Work. Anchor has the widening access to quality work, so you can see the synergies between them all. Even the ICP strategy, there's elements of that actually fits into the anchor work. And the anchor work has been going on for a while within the NHS. So I think to bring it here, it just feels like the natural home for it. And actually we can help support some of the other pieces of the work that we're doing and just kind of wrap our arms around it. So yeah, just to endorse the fact that yeah, it's come here. Thank you.
Thank you so much. Next is Nick, please.
Thank you, Chair. I was going to make a similar point to MC. I think this is a really fantastic forum for this, but also thinking about the different layers of this, I suppose, that there are things which are global and South West London may want to lean on, universities collaborating. There's a big programme within Kingston and Richmond looking at workforce at place, which is, you know, again, lots of collaborations, lots of discussions of work experience, working with FE College, working with the schools. But also, I'd suggest we could look at another layer down, integrated neighbourhood teams, how the more ward-level, localised neighbourhood working across a smaller number of schools, employers, maybe smaller organisations with primary care, local authorities, community providers, etc. So I think this works on many levels, and I think the ICP is a really useful place to have oversight of that. But you know, there's lots happening at place, and again, I think INTs are a really opportunity to look at it at another level down below that. Thanks.
Thank you, Nick. Would Joe or would you like to come back on that?
Yeah, just to echo that, and I think you know, I think that this is the natural place for those discussions, as others said, as someone new to this, and I think we can build on that. But as Nick also says, you know, look at how we can approach this at different levels and in different ways, and I think we very much support that.
Thank you. And Sarah is next, please.
Thank you. Yes, I agree with Yemsi on the fact that it's a good opportunity. As you said, there is a lot of work at place happening, so we can capitalize on that. But also I think it's really important to give it like a system level push, if you want, and drive, so that it happens equally in different places. When it comes to the voluntary sector, I think groups would be particularly interested in getting involved, obviously, with the procurement agenda, but also with the state's agenda as well. So, yeah, absolutely welcome a system-level discussion.
Thank you. Next is Charlotte, please.
Thanks. So, yeah, definitely support the workshop idea. I think that's a really good one. And I suppose just to make sure, and Sarah and I and Alyssa can help with this, that the voice of the communities that we are trying to support are actually reflected in that workshop. So we've got options around having representatives there, or maybe we have research from insight from other places, because we're not alone in doing this, but just to make sure that we are doing the right thing and hearing from the people who we're trying to support right at the beginning. But we can help you do that.
Thank you. Thanks, Charlotte. And next was Imran, please.
Thank you, Chair. So I think this is a really well thought out piece of work, and I love the framework. I think it's really, really positive. I think it's a really nice framework to work on. And this is the right kind of forum to bring this discussion here. My question is just, linking back to the previous discussion on the ICP strategy and resource and who does the work and capacity. And I wonder whether there's a bit of overlap between some of these areas and what we've discussed in our strategy earlier on. And I wonder whether, just in terms of diaries and officers and their time, whether we could think about the workshop feeding into the ICP strategy, whether we could begin to, one piece of work could hit 2 directives, I guess is what I'm saying. But I wonder whether that's something we might think about practically, just in terms of resource that we've got across the system.
Thank you. And Joel, your
Yeah,
comment?
so absolutely, and I should have also called out Angela for all her help in getting us to this point, and clearly she's influential in the other piece of work that you're referring to, Imran. So I think there is definitely an opportunity to bring things together. And just sort of commenting on a couple of other points that have been made, I think, you know, the workshop, we can clearly, it's an iterative emerging picture at the moment. We've got a sense of who we would like to involve, but, you know, we can obviously sense check with that with you and make sure we have the right people in the room. And I think this is all about, isn't it, sort of sharing, enabling and scaling where appropriate, Nick, to your point. So, you know, there will be things going on already at multiple different levels, and if there is more that we can do to sort of create the conditions to enable, share best practice, all of that sort of thing, you know, we're keen to look at it. Thank you.
Thank you. And John, next, please.
So first, an observation. So pursuing the life sciences would be a goal, but are we confident that our primary and secondary schools are getting it right in terms of STEM education? And secondly, then, that our university sector is providing the type of courses which would be attractive to large sort of life sciences firms. And I speak from Irish experience. That's been a 30-year journey, and that's why the Irish economy is absolutely booming, because we cracked the education piece first, because you know, manufacturing is one thing, but actually the innovation and research element is where the real, dare I say, wonga is. Secondly, just to sort of congratulate, admire and be jealous of the South London Partnership event last week. I thought it was absolutely brilliant. I think the NHS could learn a lot from how you work with the commercial sector, and it was interesting to see Enterprise Ireland, the state body in Ireland that deals with enterprise and Irish firms, were actually in the room in Croydon last week. So I think those are some of the things that we can do by working together, and I think there's a real opportunity, particularly in the NHS, to do more of that stuff. So thank you.
Thank you, John. And then I have Peter, please.
Yeah, I've been listening to hear something that concerns me in this field, and that is that we're talking about pulling things together and growing and economic development, and that's really important. I think it's also important that we consider, and I think Yemisi's comments were also related to this, that we consider the impact on the employment opportunities for people, and we should also always consider the impact of decisions. And I speak as somebody who represents a group of people who suffer from health inequalities. When we make decisions, we should understand the implications for those communities in terms of anchor institutions and moving things, and how that can impact adversely on such communities. That needs to be part of this whole equation. And then the other question that Graham put, I think, has been answered, because it was about how are the two, local government and health, going to work together on this. And it's quite clear to me that this is already happening and it's planned to continue. And so I think there's no point in asking a question when you've already answered.
Yeah, thanks, Peter. And just before I let Mike in as a response to what you said, I had Graham's question still on my list, but thanks that you already have taken, and I agree with you. I think we have answered it.
As is proxy.
Yeah. I know.
And Peter, I just wanted to say, I think you'd be pleased to know that I'm spending the morning at the Wilson on Friday.
We are spending.
We are. We are together.
I
Good.
look forward to.
So we can continue this conversation there.
You want to comment as well, John?
That's a demonstration that you're thinking about such issues, personally. So thank you.
Too many people have got it on.
Okay.
Yeah, Joe, sorry.
Sorry, I can't.
Turn it on. That's it.
Brilliant, thank you. And Peter, just on your sort of value and impact point, we had a missions board this morning, and we were talking about the importance of being clear on the things that we do value. So in the decisions that we make, how are we going to impact on inequalities, and then be really clear how we assess the impact of the things that we're about to do before we make those decisions. So your point was really well made, and we absolutely will build it into our approach. Thank you.
Yeah, Matthew, please.
Just building on John's point about the importance of linking to HEIs. I had a really interesting conversation with one of the PVCs, and they said the fact that you're having these conversations with us and bringing us as part of that discussion makes us think more local. And I think we underestimate that. There's no reason why a university should just look at the local area. In fact, they may well look at it in a much different way. And I think the more that we can utilise all of the assets that our HEIs bring to the local region and get them thinking in that more local way, the better. And I think that very much builds on your point, John, about linking to sort of STEM and stuff like that.
Thank you. And last question or comment from Elisa, please.
Thank you. I just wanted to build off what Peter and Charlotte said, and that is that Health Watch would be quite keen to work with you to make sure that people from deprived areas are included in the workshops. I think even just hearing about the life science opportunity, and yes, it is an opportunity, but you can see, bringing people in who, most of those jobs in pharmaceutical companies require quite a lot of education. They're really high paid. There's that, there's that implication that people be coming in who will be displacing local people, raising rents, et cetera. So I do think we need to keep, especially in our most vulnerable communities, at the center of these conversations.
Thank you, Elisa. And thanks everyone for the contribution. I mean, this was or is still isn't closed yet. My first meeting I'm co-chairing, and I mean it's lovely to see. I mean how nice and vivid the discussions and contributions are. So I mean, on the last couple of items, we really had a lot of interest, and that felt really, really positive and great work. Again, one of thanks to Joe and to Matthew. I think this is really something. Yeah, I mean, can't highlight there are synergies, and when you can collaborate and find, synergies, it's just amazing. So thank you. So we have two more items on the agenda. One is any other business. Is there any other business from anyone? I see that's not the case. Then just for me, a gentle reminder, if you haven't yet responded on the consultation on the 10-year plan from the NHS, please do so. And the last item is public questions. So we didn't receive any written questions in advance from members of the public. Are there any questions for the board tonight? That seems not to be the case. So, this is amazing. We were lagging behind, and I was sort of pushing you guys forwards there, but we closed before our official closing now. So it's 3 minutes to 6 where I'm closing the meeting. Thank you.